Thank you very much for having me. First and foremost, I just want to say thank you to the NRMA ACT Road Safety Trust who actually funded this particular research. Today I'm going to be talking about the deterrence of drug driving, and specifically as it relates to the Australian Capital Territory. So, as you saw from Max before, all Australian states and territories now have some form of drug driving roadside saliva screening testing. As you can see, New South Wales brought theirs in December 2006, and the ACT was the very last jurisdiction to bring theirs in, which is in May of 2011. Okay, just to give you a little bit of a background about the ACT, as you could see on the map before, it's very small. There's about 350,000 people that live in this territory. Median age is 34. There's only about 6,000 kilometre lengths of roads in this particular area, and there's on average 1.7 vehicles per household. When we're looking at the number of tests that were actually conducted in 2012, you can see that of the 1,733 tests that were actually conducted, there was 37 positives, and in 2013 the testing increased to 2,429 with 116 positive tests. So just some of the overarching research questions. This was part of, what I'm presenting today is part of a broader research program. So there's four research questions I'll be presenting today. And so what are the ACT motorists aware of roadside saliva-based drug testing operations? What is the perceived deterrent impact of these particular operations? What factors were predictive of future intentions to drug drive? And what were some of the differences in key subgroups? So the participants who took part in this particular research was 801 ACT motorists. They were stratified by age and sex. So what we actually did is we made sure that we got 200 young people, so age 17 to 29, and then we got another 200 people at age 30 and above. And then over that again, we then split that by males and females. So we actually have 4 separate groups. The inclusion criteria for being part of this was that you had to be 17 years or older, hold a current driver licence, and drive at least 1 hour per week. Just a brief background on the materials and the questions. Obviously we asked a lot of demographic information, such as things like age, gender, employment status, but we're also interested in lifetime and recent illicit drug use, as well as the recency of driving within 24 hours of using an illicit drug, and then again within 4 hours. For awareness and perceived effectiveness, we asked, are you actually aware of the ACT introduced roadside oral fluid testing in May 2011? And how effective you actually thought that this particular program would be. Perceived deterrence and roadside drug testing used both classical and expanded deterrence theory constructs, so certainty, swiftness, severity, and then we looked at both punishment avoidance, personally and vicariously. We were also interested in participants' likelihood of future drug driving. So we actually asked them, how often do you think that you would actually drive after using illicit drugs in the next 6 months? Now, we didn't actually collect the data in order to make this a proper community sample, because we weren't interested in looking at just offenders. We were interested in looking at how this was actually perceived in the community. We asked an independent data collection agency to collect this for us. They sourced their information from the Association of Market and Social Research Organisations using a concept called random digit dialing, or a CADDI methodology. All the data was actually collected between July and August of 2012, so we actually did that deliberately, so we had at least 12 months of this particular program being in place in the ACT in order to be able to detect whether it was having any sort of impact. The call routine included both weekdays and weekend calls, and in order to get as many people as possible. And the interviews lasted on average 12 minutes, and the response rate for us was 58%, which is a bit low when you're coming down into this particular methodology, but it was really difficult to get younger cohorts because they don't have landline telephones anymore. So you're actually dependent on calling the household and asking, is there a 17 to 29-year-old in the house? Would you be interested in taking part? So just some of the demographics before we get into it. Most of the participants were employed and drove a vehicle daily. We had around about 36% who had actually reported using at least one of the 3 illicit drugs. So we were interested in only targeting the drugs that could actually be picked up by the roadside saliva screening process. So that's cannabis, methamphetamine and MDMA. Most frequently used drug was cannabis, which we weren't surprised about, followed by ecstasy and methamphetamine. Now, interestingly, people, we don't really have a lot of MDMA or ecstasy in Australia. It's around about 2%, but people think that they're taking MDMA when in fact they're actually taking amphetamine. So that's why we actually see a higher self-report rate of MDMA. Interestingly, we got about 10%, which is slightly less than some other studies have found, but approximately 10% of participants had reported that they had driven a vehicle within 24 hours of using an illicit drug in the past. The majority of these were males, so we weren't actually surprised by that. We were interested in asking of those people who had actually used an illicit drug and driven within 24 hours, how many had actually done so in the past year within a 4-hour period. Now, while the data here isn't huge, we don't have large numbers or anything, it is indicative of somebody who's driving whilst probably impaired or would at least be picked up at the roadside if they were tested. So you can see again that cannabis was the most prevalent drug that was used, and we've only got, just close to 2%, once or twice in the last year within a 4-hour period for cannabis. But you can also see that, with methamphetamine and all that. But we are getting some people saying every day, or at least more than once a week. Okay, we also examined intention to drive after using one of the 3 illicit drugs within the next 6 months. So this question was, do you intend to drive having used one of the drugs? Now what we did is we actually broke this down into the number of days over that 6-month period. So the range was actually between 1 and 180. So among those who actually did report, we could actually see, so there's 40 people who did report to drive after using one of the illicit drugs. About 5% of them said that they would, and of that, the average number of days was around about 27. So we're looking at least once a month that people are saying, yes, I would intend to drive. This is also knowing that the new roadside legislation is in place. So awareness and effectiveness of the legislation in the ACT. So most of the participants were actually aware that the operations had started in May of 2011. But interestingly, 35% of them were completely unaware. So the response to this question was, yes, I'm aware, I'm unsure, or no, I'm completely unaware, got no idea. So 35% were completely unaware of this. I should back this up by saying that the ACT never implemented a lot of advertisements or marketing or anything with their particular program, whereas conversely Victoria did. So this is probably one of those areas, but I'll talk more about that later. So of those who had actually driven within 24 hours of taking an illicit drug, 41% had actually done so since May of 2011. And then regarding perceived effectiveness, only around about 50% reported that the operations would actually be effective in detecting people at the roadside. So within this particular jurisdiction, there's not an awful lot of confidence that it would be all that effective. Here I just want to talk about the perceived deterrence effects. So when you're looking at your classical deterrence theory and then when you're looking at reconceptualised deterrence theory, and I haven't gone into a background on those, but happy to if anybody wants to talk in the break. So when we're looking at certainty, swiftness and severity, you can actually see that there was only like a moderate or medium sort of thing about certainty. And certainty is actually supposed to be our strongest predictor under deterrence for why, somebody would not do something. Severity, people actually thought that the punishments that they would receive if detected would be high, but it wouldn't happen very swiftly. We only had one person who had experienced actual punishment in this thing, so we couldn't actually analyse anything to do with punishment, actual punishment. But when we looked at the constructs of punishment, avoidance of vicarious punishment, it was very low. So people's actual experience of this in this jurisdiction is quite low. So what that means is that, if they are detected, well, if they are at the roadside, they're not being detected, or they've got very little experience of that, and the vicarious is through somebody else. Before I go and talk about the multivariate sort of analysis, I just wanted to quickly show you just the univariate correlations or relationships of variables. And you can actually see, again, that the punishment avoidance, so this is the strongest predictor under this particular deterrence model. So people who have been using, they may have gone through an RBT site or anything like that, they're not being detected, so they're actually getting away with it. So that's the strongest predictor here. You can see vicarious punishment, so those people who had known of somebody to be punished, but it wasn't themselves, had a negative relationship, albeit it's not all that strong. And then the vicarious punishment avoidance again was high. And this was on the prediction of intentions to drug drive in the future or the next 6 months. So these are the factors. This is when we're doing our multivariate analysis. So it's when you put everything in and you see what's coming out. In our first step, we actually put age, sex and awareness of roadside drug testing into the model and could see that it was age, so really being a younger age, and awareness, so yes, were the predictors. Interestingly, when we actually added the 3 components of classical deterrence theory, the model didn't change. And that was actually surprising to us because we thought that maybe something like certainty, swiftness or severity would have come out, but this is why we do multivariate analyses. What did change, though, is when we put in the reconceptualised deterrence theory constructs. And so where age has stayed the same, so it's remained significant, with younger people more likely to engage in it in the future. The awareness changed, but what we've picked up is that the punishment avoidance, vicarious punishment avoidance, were the 2 reconceptualised deterrence constructs that popped up here. Very quickly, I just wanted to talk about the subgroup differences because we did actually have our stratified sample. When we're looking at the difference between males and females, we can actually see that intentions was higher in males, albeit it's not significant. Awareness, again, was higher in males, and overall drug use was higher. Certainty, though, of being detected was more likely for females. And punishment avoidance, albeit it is significant, it's more likely for males to have experienced that. Looking at the difference between the younger and the older cohorts, we can actually see that, again, it's the younger people. The older cohorts, however, had a greater awareness, and the younger cohorts were over all drug use. Certainty, swiftness and severity was interestingly higher in the younger cohorts than the older cohorts, which is what we didn't expect to find. And we can actually see that of the reconceptualised deterrence theory variables, it was vicarious punishment and vicarious punishment avoidance being higher again in the younger cohorts. So what does this all mean? Overall, the results are actually here showing we've got a relatively poor awareness of roadside oral drug fluid testing happening in the ACT. Despite the half of the sample reported operations be effective, a substantial proportion did not perceive that the certainty would be high. Instead, there's actually a tendency for the drivers to believe the chances of being caught for slim to moderate only. None of the classical deterrence theory variables were predictive. So what we're arguing is that it may actually take considerable time and effort and awareness and perception of the apprehension to impact in this particular jurisdiction. And our current findings would suggest that the expansion of the roadside saliva-based testing campaign is warranted. What we're interested in is 2 things. How do we get anybody who's, say, sees an RBT and then thinks, I could also be drug tested here. We need to, that's our general deterrence. How are we going to increase that? And we're also interested in how are we going to increase our deterrence, in particular for, say, recreational drug users. How do we get the same message through that is about, if you're going to use drugs, don't drive your car, or, don't use the drugs in the first place would be good, but seeing we're not going down that avenue, it's the same as what we're doing with drink driving. How do we make that message the same? How do we say, if you're going to drink, then don't drive, and if you're going to drive, don't drink? We need to actually get that sort of message back out to the drug users as well. So thank you very much.